Hi, g'day, thanks. I might as well get started. Good afternoon, my name's Adam Pastola. I'm a principal from Lyons, and it's my pleasure today to share with you the new Joan Kirner Women and Children's Hospital in Sunshine. It's a major investment by the state government and VESBA in the health infrastructure in Melbourne's growing west, and because Melbourne's west is growing, it's growing because families are growing, and this hospital is obviously increasing in a very substantial way the provision of health facilities for women and families in Melbourne's west. But it is also a place where we feel that we can bring some design principles in terms of transforming the experience of coming to a hospital, of working in a hospital, and a design approach which our practice has developed over a couple of decades working in this space is the approach of salutogenic design. And this is a evidence-based and a research-based series of design principles that are around, for example, improving the connection of the interior to the exterior with access to daylight and views, improving or simplifying the wayfinding and having a sense of legibility to the next step in your journey for the project, using colours as a way to structure your experience through the building. And hopefully what you might see through this presentation is how we've used some of these design principles to transform what is a very hard-working and a very complicated health project. Thinking about hospitals as primarily interior spaces, it is an extension of the interiors of the whole hospital campus, and it is a new project woven here into the hospital campus, but it is connected functionally to a number of different buildings, including down to the main entrance of the hospital and to the emergency department as well. In terms of some of the very simple planning principles here at ground, the front entrance has a strong connection to the drop-off and patient pickup here. That's facing towards the east. Upon entry, you're greeted by the main reception desk and the main two banks of lifts, which provides against a very clear translation of what your next step may be to visit someone or to attend one of the clinics that are upstairs, or even very simply access the children's clinics that are on the ground floor. In terms of starting to transform this as a piece of hospital infrastructure, the foyer is designed to have light from both sides and connection to outdoor spaces on both ends of it. The hospital, it is a large metropolitan hospital, 10 stories tall, with 9 levels of operating theatre, CSSD, wards and other support spaces, and the wards, as the more quiet recuperative spaces, are located on the upper level of the project. And fundamentally, the project is about creating comfort for patients and families as they spend time here. Often a visit to hospital is stressful, but in this case it can also be joyful. It is a significant moment in many families and people's lives. So these are some of the paediatric wards, and you can see where we've used colour and warm materials to create a more domestic feel to the space, as well as within the birthing and neonatal suites, providing space for families to be with mothers at this time. The plan is very hard-working. It is a hospital. There are a lot of functional interests that we need to resolve here, but we have been able to, through a very careful manipulation of the plan, for example, through moving the stairs to the corners here, allow for these views down the end of these long corridors. By the lifts moving out of the building, we create this light-filled lobby, which again has access to panoramic views, and then also introduce a number of small family lounges and outdoor spaces on these upper ward levels. Many of these connect to large windows that are visible on the exterior, connecting to those more long-distance views back to Melbourne and all across Melbourne's west, and some of these do connect to outdoor terrace spaces too. The interior spaces, again, they connect to these views across the hospital campus. These are some of the waiting spaces on the lower clinic levels. And here you can sort of start to see how we've started to use colour as a way to structure the navigation through the project as a wayfinding device, and each of the levels has a different colour scheme, which does talk to the exterior, and the exterior itself was derived through taking a sample of the colours of Melbourne's west, ranging from the colours of the landscape, of the terracotta roofs and the urban forms and the sky, and stretching these through a process to generate the exterior form. which also does have an implication for the interior too. Coming back to the ground floor and how it begins to connect to the outdoor spaces, you can see there's this theme of circles which runs from the outdoor spaces through the foyer and starts to form the shapes of the reception desks and the staff bases all throughout the project, again providing a very simple clue as visitors move through the interior space that these are the go-to points to interact with staff and to ask questions. So this is a little walkthrough of the project arriving from the main drop-off, which is woven into, again, a very hard-working and busy car park. But we use colour here to draw visitors into the project. But when they do come in through the front door, it's actually white, and there's this sort of suspension of the colour scheme to really frame the reception desk, frame the integrated art, including this work here by Emily Floyd. The lifts are very clear to find and visible, and they're clad in timber, but there's also views up to the upper levels, up to level 1, where some of the clinics are located as well. And then moving through this hard-working ground floor, there are places for kids of different ages to play, including with sculptures and these interactive screens, as well as a number of separate waiting spaces, including seating for people of all ages, but again having artwork, including this moving artwork by Alexander Floyd, as a form of entertainment and distraction for the kids. And just behind here there's one of those secure courtyards as a children's play space. And again, there are these views into this main foyer space from the upper levels, which have some of the clinics for young children visiting the hospital. Looking for the interior, we've used quite a different concept to the exterior, which is a striated and rectilinear form. We've used these references to circular forms and their connection to, obviously, to ideas of growth, which Western Health were really positively supportive of. But it allowed us at a design level to create a series of different circular forms throughout the interior, which created everything from seating, joinery units, bulkheads, as well as some larger spaces on the interior. And these are some examples of our design and construction and prototyping process of using that reference to the circular growing forms to create these main reception desks, these lily pad-like seats for children, as well as some of the other furnishings throughout the project. And here you can see how we started to use that idea of the circles to navigate that transition from outside to inside, highlighting the reception desks and the staff points to provide a legibility to what is, again, a very hard-working, functional plan of within the project. So this is a view coming up to the reception desk, coming in from the front door. You can see through the project one of these secure courtyard spaces. Wayfinding was a key element of integration in this, providing just a very simple messaging of what the next step is in your journey, as well as providing views to upper level spaces as well. And then we've used this theme of the circles to highlight the main waiting spaces and staff bases on the upper levels, and then also give each level a different colour scheme so that it's legible. If you're coming back here in the future, many people do revisit hospitals for different healthcare needs. It starts to build up a mental memory of their visit to the hospital and where they need to go, but it also allowed us to start to create legible entrances and destinations for some key areas, such as the pharmacy located on the ground floor. And just finally, how we reconnected the exterior colour scheme back into the interior, which was again sampled from, in the terms of the exterior, from the terracotta roofs, landscape form and skyline, using similar references from the west to build up the colour scheme for the interior spaces here on the level of the birthing suites, using some narratives from the Western Plains, and then using other motifs on some of the upper levels as well. So for us, we found it to be an incredibly successful project, being able to further push what is a very resistant typology in terms of programmatic change, but through using these principles of salutogenic design, colour, simple wayfinding, comfort, connection with landscape. We think we've been hopefully able to add a more meaningful experience to visitors, transform some of the patient areas into a more comfortable feeling space, as well as providing, I think, a real sense of celebration to this being a major hospital in Melbourne's west. Thank you.